The Milestones series on recovery, tracking the milestones of the recovery world, chronicling the industry leaders, revealing their insights. Milestones, saving families, saving lives.
Josie, tell us a little bit about how you're making a big difference and an impact within the industry and helping people in recovery.
I just received an award that I was honored by the Writers in Treatment, being the voices, or the voice of recovery. It's a multimedia award, so that just kind of gave me a moment of clarity that I am making an impact, a huge impact, as you mentioned, with my networking and my recoveryview.com website, where we give education, and we have over 100,000 subscribers internationally and nationally that come to our website and that enjoy our online journal and connecting with each other. So we've brought the industry, the professional industry of recovery together, or at least that's what I've been working on for the last 15 years, and I think I've made a big impact to have the clinicians speak to each other about the work that they do with their clients. Then they don't feel like they're just on an island on their own taking care of their clients. They can learn from each other and get new tools and techniques. And in general, that helps the recovery world.
What is the benefit to the families and to the people in recovery of the unification of the industry?
I suppose that would be that the family has more information about where they're sending their loved ones. So if they were to go to our website or click from our website to their website or learn about different programs out there, then they have choices, they can ask questions, they don't have to feel nervous about, you know, where do we send our family member, do we just send them to the one particular program down the street. There are many options for them to look at in the way of different treatment centers nationally. So the industry is actually quite small. So you don't have to feel like if you live in a certain area, you just go to treatment there, although that might be wonderful. But you could, you know, by learning more resources, find something specific to your loved one's needs, whether it be a young adult program or an older adult program or a chronic pain with addiction program or, you know, specific program. Regardless of where it is in the country, you would send your loved one to that program.
So by unifying the industry and then offering them your website, which is like a portal of resources, it gives me, the end user, the person that's saying, where do I go if I need to go into a treatment center, or where do I send my loved one? It gives me many more options, which means it gives me greater choices and greater power.
It gives you options from our directory of the treatment centers, but it also gives you education, because we have the authors who are the pioneers of our industry writing for us. We have Claudia Black, Dr. Tian Dayton, John Bradshaw. We have wonderful, and then local clinicians that are writing articles for us, local meaning anywhere in the country, but it could be a small practitioner that has a passion for a certain modality he's using. Those are articles that we have, so you could read about different treatment modalities or learn about codependency or any of those things that you're not sure about, and then also find treatment centers that might work well with those.
So why is education so important to someone that's either has an addiction or is about to enter recovery?
There's only one chance sometimes to get into the right program. So if you don't have that information base and you're not going to, well, not that any program is right or wrong, but
it may not be the right program
may not
for that person.
Specific,
right.
Whatever their need is. So I think information education is important for anybody. And then they feel connected because they're like, okay, well then it wasn't really my fault. They're not so, obviously then they're not just unaware or thinking they're the only ones. You know, they could just learn about what's going on with their family member or themselves and go, okay, now there's a solution for that.
So education is obviously one of the greatest advances in the industry. Is there another advance that you're proud of within the industry? Education
is one. Medications, I think there's a lot of research right now about medications, and the going back to the beginning where perhaps less medication is better. And they're finding that now, where for a while there I think there was just medication, and there are certain medications that are good, you know, but then we're finding now that maybe less is more again, so that's nice. So there's research behind, I think, what our pioneers always knew. I think another big breakthrough would be neurofeedback and anything to do with what's going on with your mind and mind-body connection, but from a scientific standpoint and through research at UCLA or different institutions, I think it's phenomenal because, and again, it solidifies what we may have known, but we really didn't know scientifically.
So would you say that the advance really within the industry is that we're now looking at a person as a whole. We're looking at them mentally, physically, emotionally, spiritually, and even, neurologically.
Yes, yes. I see more of that now. And to where it used to be maybe behavioral health would be on one side and addiction on the other side, and now, and perhaps religion in the middle, and now I see them connecting to work the whole mind, body, spirit truthfully, not just saying it.
So we're taking a real holistic approach.
Yes. Whether somebody wants to say it's holistic or it's kind of
holistic in the sense of complete.
Complete, yes.
Josie, for what are you grateful for?
I am grateful for my family the most, my husband and my children and my mother.
And professionally, for what are you grateful?
I'm very happy with my peers. I love my colleagues. I love the people I work with, just even though we may not work in the same office. The industry we're in is, again, it's a small industry, so you could have a treatment center in another state and that's your colleague. That's my colleague. So we work together in this field, even though we may not be at the next desk over. But you can call somebody and we help each other out. So I love the networking and the friendships and the colleagues that I have in the industry and the opportunities that have been given me by the industry to work in this wonderful field of recovery. It's addiction, but I like to say recovery because the work we do is recovery work.
And how can people within the industry contribute even more to the betterment of the industry?
I would say by just continually every day remembering that they have to look at themselves in the mirror, that we're doing this for our patients and our clients. And if you forget that sometimes, maybe take an intake call or go into a group with your staff, just to connect with that patient or the patient's family as a reminder of why we're doing this. I think as long as we're reminded and we don't get too busy around not keeping the patients first, then we'll always want to do the best that we can.
And Josie, what is your connection and relationship with Milestones Ranch Malibu?
Well, let's see, Denise and Glenn, I would consider them to be two of my favorite people in the world. And Denise is certainly one of my best friends. I was their marketing consultant and helped them for about 4 or 5 years as a national consultant and event planner. So we've been putting these events together and we're like family, really.
And what else would you say is unique about Milestones Ranch Malibu?
I would say the dual diagnosis piece. Whenever I have a person calling or a family member that needs more than chemical dependency, I think of sending them to Milestones Ranch Malibu because I know that Denise has the best clinical program and the best clinicians she can find. I mean, Denise makes sure that she's got the best staff and staff ratio to the patients.
Sometimes when you're working in the industry, even though you might be recognized with an award, you don't necessarily hear to the full extent of the amount of recognition and validation and even gratitude that you truly deserve. So on behalf of everyone, we just want to say thank you very much for the great work and the way that you are unifying the industry and the way that you're actually leading the industry. So thank you for being the voice of recovery, Josie.
You're very welcome. Thank you, Patrick.